Hello, my name is Avital Graves. I run the Mobile Integrated Health Program for Montgomery County Fire and Rescue. On behalf of MCFRS and Collingswood and Marquee Healthcare Services, thank you for joining us for this informational video about how we can improve our ongoing relationships between EMS and skilled nursing facilities. We appreciate your attention and time today as we review best practices and how EMS and nursing facilities can support each other and our collective patients. Thank you for watching and enjoy the show. Thank you for joining us to improve working collaborations between long-term care facilities and Montgomery County Fire and Rescue. This brief video will review best practices when responding to a long-term care facility. Best practices when responding to a long-term care facility include reviewing the call nature and comments on CAD upon dispatch and en route to the facility, reviewing premise hazards associated with the facility, and bringing in all necessary equipment the crew will need to properly assess and transport the patient, including stretchers, jump bags, backboards, collars, and other equipment. Providers should know entry and egress points into and out of the facility. Use the door code if provided by the facility, or use a doorbell. Consider a Knox-box key at night and/or on weekends when entrances may not be staffed. Identify yourself to facility personnel. Please show a level of professionalism and respect to staff and patients. Understand that all facility personnel can and will respond differently to emergency situations. Remember that there can be varying levels of care providers at the facility. Be courteous and speak to the most appropriate provider pertaining to the patient's care, i.e. a charge nurse or certified nursing assistant. You can also ask about a person's credentials in a polite manner by asking what their clinical role is within the facility. Loading the patient for transport can be challenging, especially in tight spaces. Don't hesitate to utilize staff on hand to help in safely moving the patient from the bed to the cot. Notify staff at the facility which hospital the patient is going to for their knowledge as well as the family's. Take hospital preference into account whenever possible, and remember to ask where they came from for repatriation purposes. A note about hospital transports. You may need to remind facility staff that MCFRS will always attempt to transport a patient to the hospital of their choosing. However, depending on call volume, specialty capabilities, and potential need for repatriation, we may need to choose a hospital other than the one the patient or staff prefers. If there are any issues between staff at facility and the responding crew, please contact the EMS duty officer as needed. Let's review and see how this EMS interaction goes when we put all of our best practices together.
Are you on your way? All right, I will be with her and the paperwork will be ready before you come. All right, thank you. Miss Gloria, I'm going to stay with you till 991 comes here, okay? So if you need anything before then, let me know.
In order to find door codes that may be listed for the facility, click on Premise Hazards on the left side of the CAD screen. Once you click on that, you'll see a tab at the top that says Door Codes. Does your dispatch information indicate that you might have a critically unstable patient? If so, do you have the correct equipment to stabilize the patient in place before packaging and moving them?
Good morning.
Good morning.
I'm Pat. This is Jonathan. We're from the Montgomery County Fire Rescue Service.
Oh, nice to meet you. My name is Milton. I'm the nurse to Miss Gloria. She's an active person, oriented ×3. She's a dialysis patient. She went to dialysis yesterday. She has a history of hypertension and diabetic. During the care this morning, the aide called me that she's not feeling so good. But after the assessment, I noticed that her blood pressure is low, her sugar is okay. So I called the doctor, and the doctor wants us to send her to the hospital for further evaluation.
Okay, thanks, Milton.
Okay.
Miss Gloria. Hi, my name's Pat. I'm with Montgomery County Fire Rescue. This is Jonathan. They told us you weren't feeling great.
No, I'm tired. I just want to rest. I don't feel good.
Okay, is it okay if my partner gets a set of vital signs for you? Would that be okay?
Yes.
Okay. And is this her official
Yes,
documentation
yes.
with her MOS form?
Yes,
Thank
everything
you,
is
Milton.
there. You're welcome.
So I have a couple questions.
Okay.
Miss Gloria is saying she did receive her morning medication this morning.
Yes, she did.
Excellent. Do you know if she's allergic to any medication?
No, she's not.
Okay. So we're just going to finish up with our vital signs and we're going to run her through a couple other diagnostic tests.
Okay.
And we'll go from there.
All right, thank you.
Did you speak with her doctor this morning?
Yes, I spoke to the doctor before calling you. She
Okay.
said we should send her to the hospital for further evaluation.
Okay, thank you so much.
You're welcome.
I didn't find any signs that point to a stroke.
Okay.
So I think the best course of action is to move you from this bed to our cot and we're going to run you down to the hospital. Is that okay?
Do you need help?
That would be great. So we're going to lower the cot and
Okay.
we'll put it right next to the bed and we're going to remove that railing
All right.
and then we'll all get coordinated, okay?
All right.
All right, just so we're all on the same page, we're going to be using this inner sheet, okay?
All right.
We're going to be doing it on Jonathan's count, okay?
All right, everyone ready?
Yes.
All right, 1, 2, 3.
So please, which hospital are you taking her to?
So we're probably going to head to Shady Grove.
Okay.
Is that the last facility you've been seen at?
Yes, I like them.
Okay, I'm going to go ahead and consult with our EMS duty officer, and he's going to make that final determination
All right.
for us.
Okay.
But we'll let you know before we leave, okay?
All right, thank you.
You're welcome. Thank you for all your help.
You're welcome. So, Miss Gloria, take care, okay? I'm going to call your daughter.
You're going to call?
Yes, I will tell her you're at Shady Grove.
As you've just seen, preparation is the key to smooth interactions with our area facilities. Remember to be courteous and respectful. Thank you for working with our facility partners to improve patient outcomes.